hope you're well. And today we're talking about how would you treat a transient ischemic attack. And first and foremost, you would give aspirin 300 milligrams immediately, unless contraindicated, and you would give a PPI, obviously to sort of treat the GI bleeding and GI ulceration that's associated with NSAIDs. Now, as we're on NSAIDs, an important point to understand is NSAIDs are contraindicated or even cautioned in severe heart failure. So depending on the heart failure, because NSAIDs work by sodium water retention, it can potentially cause problems, and it does cause problems with heart failure. And the way you can remember that is when you have heart failure, you give diuretics to relieve the edema of a patient that has heart failure. So this is very, very important. And let's go on to the cardioprotective nature of a patient that has CVD. Now, so when it comes to cardiovascular diseases, you need to be careful with sort of what diet they take. So the diet should be of cardioprotective nature. So generally with most chronic conditions, you wouldn't straight away give medication. You would give a diet and lifestyle management first, then you would go on to that. So with diabetes, generally we start with diet and lifestyle management. Then you can give, depending on the current diabetes guidelines, because it's changed now, where you would give a modified release metformin with a SGLT2 inhibitor rather than instant release. So depending on the demographic and what other comorbidities they have, etc. So, and also not to forget, with metformin, you wouldn't give. So if someone has GI irritation, you would always give modified release to avoid the GI irritation associated with metformin, and that's an important point. But because we're on cardioprotective, let's go through it. So the limitation of alcohol units is 14 units a week, spread over at least 3 days, and eat at least 5 portions of fruit and veg per day and 2 portions of oily fish per week, and reduce the intake of saturated fats. And that is a crucial point to understand when we're going through cardiovascular diseases, because a cardioprotective diet is a part and parcel of the treatment. And thank you.